This is the Drake Insights Podcast, your weekly dose of cutting-edge senior living marketing insights. Join me, your host, Natasha Drake, for bold ideas, proven strategies, and inspiring stories straight from the experts. Tune in and let's conquer the senior living marketing landscape together. Hi guys, welcome back to another episode of the Drake Insights Podcast. I'm your host, Natasha Drake from Drake Strategic. Let's get started. So on today's episode, we're going to dig back into the clinical side, the nursing side. I try to touch on this as much as I can. You know, it's really important when we work in senior living that we understand actually the care that's being given, right? And the care that's being done in our industry. And so I have an expert on who I've worked with for over 5 years, almost 7 years. We work together. She has a ton of experience. And I want her to share with you a little bit about how she started her company, Concierge Care Network, how she got here. And we're going to dig into care, clinical care management, really understanding what do you think it is? What do most people think it is and what's included? And where are those big missing gaps in our country, not just in senior living, just overall. I'm sure from a professional senior living experience, you've seen it, but also we've all seen it from a personal experience. We all have a family member, a loved one, where we've had to make decisions, and there's a huge gap missing. And Lorie is really helping to fill that gap. So, Lorie Dancy, welcome to the show. If you wouldn't mind, introduce yourself. Tell everyone a little bit about your background. I think it's important for context for people to understand your full journey and how you got here. So, welcome.
Well, thank you, Natasha. It is great to be here, and thank you for allowing me to be here to just share some of these things that are really passionate to me, important to me, personal to me, and really have just evolved throughout my career as a nurse, even prior to being a licensed nurse. So, yes, I think you're absolutely spot on. It is so important. When I think about the business I've started, I have to really talk about just my history in nursing and in caring for people, because that's really, the origin of everything for me in terms of what I love to do and my passion. So I've been a nurse, an RN, a registered nurse for, over 30 years now. And even prior to that, I was in healthcare. I worked about 3 years while I was in undergraduate school at Delaware State University. I worked as a CNA, which is a certified nursing assistant, in a nursing home in memory care environments. So this is early 90s. And I worked as a home health aide. So I would go into people's homes and take care of their loved one, providing them support with bathing and dressing and feeding and ambulation and things like that. So I purposefully did that while in undergraduate school to, one, make sure this was something I was going to enjoy and like doing.
Yeah.
And found that I did enjoy it. I really liked the outcomes, to see people either feel better, feel good, or improve. And to also determine that if I do like this, then I want to understand the entire spectrum of nursing, because you kind of never in nursing, as you maybe grow as a nurse, you never leave one for the other. It just builds upon each other, those skills. So it was really great to do that. So I did those things, and then I became a licensed nurse and started working, as many nurses do, in a hospital, acute care. I worked in medical surgical nursing for a solid year, just getting my, feet going and understanding what it's all about. I had the privilege of taking care of a lot of patients who, at that time in the mid 90s, were HIV positive and AIDS. So here we're in the middle of an epidemic of the AIDS crisis. So it was a big part of my population. And I decided after about a year that I wanted to know more. And I would have one of my patients, something would happen. They would code, is what we call it, so either their heart would stop or they would stop breathing. And this whole group of people would come, and I'm like over here in the corner, and we're working on my patient, and then they're gone. They took them. I'm like, where'd they take them? What? So I started to want to know, I want to do what they're doing. and I want to know what happened to my patient. So I transitioned into the ICUs, and that's where they were taking them.
Mm-hmm.
And that was the team that was coming, from the ICUs to really come and resuscitate and revive someone. So I did that really for many, many years and was on the code team and working in the medical intensive care units and the surgical ICUs and the cardiac ICUs. And
Wow.
I loved it. So with that, while working there, I decided I wanted to go back to school. So I did some graduate work at LaSalle University in Philly. And I graduated with my master's in nursing and as an adult nurse practitioner and loved it. You know, what I found was that I started to have a passion for older adults as I was working and in school. And a lot of my work and study and emphasis was on older adults. So upon graduation, I transitioned into senior housing and have spent many, many years, over 20 plus years, 20 over 25 years almost now in the senior housing industry, working in there in many different facets. Sometimes it's been as a director of nursing or wellness director in a community. Sometimes it has been as a consultant for those that are running those livings and memory cares and independent living communities. And I've consulted with the operators and managers, sometimes the investors and the REITs. And it's also been just working and managing and overseeing their whole clinical and quality departments and activity engagement departments, and making sure that the quality is there, that people are getting what they are to have. So it's been a great ride. I've sprinkled some other things in the mix there, some home care as a professional, some education, as a professional as well, and even took the step and leaving the corporate world in senior housing and going back into a community back where I
Yeah.
started as a wellness director, or director of nursing in a sense. It was a kind of a bit of a different role, but I really thought it was important when you're leading people and when you're having expectations of people that you remain current
Yeah.
and understand what is happening, what's changing. So took that step and also even did some hospice work. So it's been a great experience, in my nursing career, I would say.
Yeah. I don't know if I knew all of that. That's amazing. I mean, I always knew, we worked together for almost 7 years or over 7 years. You were
Yeah.
sort of our nurse. I feel like we used to come to you all the time for things that you're like, this is not my job. But we loved having you on the team. We knew you're so educated and you know so much. And thank you for giving all that context. I think it's important for the listeners to know that that's why, and your credibility of why you created this and sort of all that you've seen in our industry and in our nation in general in the care world. You've seen a lot of different sides. And I think that's what gives that credibility and that insight from you is really important to talk about this topic. So before we dig into the topic we're talking about, I do want to, if you can share a little bit about what then, or kind of give a context of what we're going to talk about today. What got you to then start this company?
Yeah.
What was it you were seeing and wanting a change? Because as I said in the beginning, there is a gap. There's very much a gap, which I don't even think I realized until you and I
Mhm.
spoke and how you
Mhm.
created this company, that there is a gap missing of care management. And
Yes.
and if you can share a little bit about that story and how you got to create this.
Yeah. Yeah, absolutely. You know, and I've thought about it because it was a big step,
Mm,
to decide to start this business. And, I really spent time thinking about it first and why and the hows and all of those things
mhm,
as well. But it's been through many years of having worked in different areas through healthcare, as I was just talking about, and seeing some similarities and common threads.
mm,
Unfortunately, a lot of those common threads have been the gaps.
mhm,
That's the common thread. I mean, as much as we try to do, and we put systems in place, and we have, measurements of things that we have to follow and try to achieve. We have processes that we put into place. We hold people accountable as much as, we can and should. There are gaps that are just there. And I have found that across the spectrum. It's interesting when really thinking about it. My first experience in really identifying a gap through hindsight was,
Mm.
when I worked as a home health aide in
Mm.
home care in the early 90s. And I was the home health aide for a little girl who had
Mm.
cerebral palsy. She was 4 years old
Mm.
at the time. And it was my responsibility to go into this home. I finished my college courses during the day, and I'd go in for 4 hours, 3 days a week, and I would kind of give her mother a break, and so she could run to the
Wow.
store, she could go do things. So I would, be with her, I would feed her, I, get her washed up and ready for bed, those types of things.
Mm.
But interestingly enough, once you're spending time with people and you're going into their private space, their home, you get to know them and
Mm.
you get to see firsthand what they're dealing with, where their challenges are, their struggles may be. It's never the one thing why you're there. It's so much more,
Mhm.
that's feeding into the situation. And it's ironic because with this family, it grew into they had two other children. One was maybe 2 years older than the child I was caring for. One was about 4 years younger. She
Mm.
was a baby essentially.
Mm.
The family ended up having personal struggles, going through divorce,
Mm.
children growing and, seeing and experiencing different hardships in the home. And, it was interesting because I after I left this family, even working with them as a home health aide, they remained very much a part of my world and my life, and was with them through so many of life situations, remarriages,
Mhm.
even to the passing of the child at 23, 24 years old that I cared for since she was four,
Aw.
or when she was four, for a year and a half.
Mm.
Only a year and a half I was there doing that. And here now we're 20 years later. And, the mother's asking me to be the maid of honor in her next wedding.
Ugh.
So it's amazing,
Hmm.
that when you're spending time with people, the healthcare puts you there for a reason. You're there for a reason. That brings me through the door. But
Mhm.
there's so much more that is
Mhm.
needed really for the family as a whole to support them properly and well and to take care of that person
Yeah.
that I'm really, there for. So that was really my first kind of
Wow.
inkling, like there's a lot more going on here. There's
Yeah.
a lot more happening here, often because of the struggles of the care of maybe that one individual, other things are happening.
Right.
So that, was my first introduction. And just through the years, even to my own personal experiences with my parents, who, I really acted as their care manager in a sense, in their through their disease processes over many years, of really about a decade. And, I kind of saw that it required so much,
Hmm.
but I loved it. And I felt like if I can do it this way
Mhm.
for the people that I love, everyone should have this for who they love. Everyone should have someone who can answer the questions, pay
Mhm.
attention to the details, understand what's happening, educate, explain, train, support, be able to identify things. Everybody should have that. And unfortunately, there's not a space created for that in our healthcare system, right?
Yeah.
There's a diagnosis, a need, and we treat,
Right.
which we have to do. So that's kind of what has prompted me to really become a care manager for people as they age, whether they're living in their private home or whether they're in some sort of, community or facility, as well as supporting the communities like assisted livings and memory care communities so that they can offer as much of that as possible to
Mhm.
people living there, which is really hard to do when you have maybe a nurse or a nurse who's passing meds when they're there. What else is happening with these individuals where their loved ones are really depending on the community to be that person, but it's hard for them to do that.
Yeah, with that many residents. Yeah.
Right, and to do it well.
Right.
So also providing a support to them to create that pathway where the community is meeting their expectations, and the residents and families are also getting their expectations met.
That's amazing. And I think many people may be listening because ignorant me who kind of first started on this topic, I kind of started doing some research. If we can dig into what do most people think that this is? I think most of people who aren't in senior living aren't nurses or clinicians, by trade, think, okay, that there is going to be, I feel like I kind of thought that there is going to be someone who just think, like my parents and my family, there is someone who's going to walk them through that. What does that look like now? So I know that there's like social workers and there's some plans put together, but what does that look like? And what are you seeing? Where are the biggest gaps you're seeing?
Yeah, I mean that is such a great question because I'm definitely seeing some trends.
Mm-hmm.
I would say I'm seeing one, there's much more of a clinical focus
Mm-hmm.
that's needed and that they're asking about and that they are uncertain about. And they are looking for that direction
Mm.
and that input, but they don't even know what to ask for.
Right.
Some of the time, they don't know what they don't know. A lot of people, you just don't know what you don't know. And, you have your 7 to 8 minutes when you're with your, primary and your physician, and you can get those questions out if you know what to ask.
Mm-hmm.
And then if you remember everything, when you have a new diagnosis or new medications or you're experiencing certain signs and symptoms, and then you come home and it's like a flood,
Yeah.
so there's definitely that need of support clinically and care wise, and just people to know that yes, there are resources there. They're just sometimes very difficult to tap into and to identify and to locate and to know where they are. A good example is, when my father he was diagnosed with Alzheimer's disease, and I had a program for him where he was, being engaged every 3 days a week. And it happened to be virtually, and we'd have to get him set up. It was an amazing program, and I just loved it for him. And it was great for about 2 years until he started to advance
Mm-hmm.
and needed more. So he still needed that level of engagement. Well, I found it happened to be in my town, the only Alzheimer's respite social model adult day center, period, social or medical,
Mm-hmm.
Alzheimer's in the state of New Jersey. Happened to be 2 miles away,
Wow. Well, that's good.
which was great. That worked out well. And it was perfect, for him. So it shows you there's such a need for these supports, but you have to also dig and find where things are and know where to find them. And, so people don't know they need that clinical support. They need that support with care, and what does it look like. They don't even understand the norms oftentimes of things. So that is something that I'm definitely finding. And then the other part that I'm really finding is that people are asking about engagement, especially when it comes to dementia.
Mm-hmm.
Finding that in the home, when people are living at home specifically, they want to know how to keep them active and engaged. Now, they don't ask it that way
Right.
oftentimes, but that's what they're asking. So to me, that is just as important as what people tend to think of as just care,
Mm-hmm.
because that is care. It just is very therapeutic. There are a lot of benefits to activity engagement. So that is something that is very, I'd say, unique to the care management that I do with Concierge Care Network, because the engagement piece and the building of a personalized activity regimen and
Mm-hmm.
engagement regimen is part of it. Is part of it. So it's not just, let's set up your med box type of thing, or let me get you to your doctors. It's very
Right.
personalized, very individualized, because we want them to be successful.
So I think what I hear you saying, if I'm saying this correctly, is right now the way it exists is there's sort of a case manager, to say a word, that sort of helps, get things taken care of, right? To the doctor's back, maybe relaying messages, making sure they have what they need at home. Okay, the doctor said this, let's make sure it's here. Great. But there isn't someone who's necessarily looking at it holistically from a whole
Mhm.
perspective. Like you said, there's different diagnoses. what's really going on here from a full big picture. And then also you were saying families don't know, like you said, what questions to ask. I mean, I would have no idea. What are those further questions? And
Mhm.
frankly, unfortunately, not that's a whole nother topic, but that's how it is at doctors now. I feel
Mhm.
like I'm like, when
Right.
I go, I'm like, I got to be prepared. I got to have my list of what do I want to ask the doctor ahead of
Mhm.
time. I don't know what I don't know, so I don't know what to ask. So I can't imagine as you get older and you're dealing with these much more difficult diagnoses like Alzheimer's, families don't know what questions to ask, and therefore there's things missing, right?
Yeah.
Whereas someone like you, a clinician who's actually there not just from the care management
Mhm.
support or the daily task support,
Mhm.
but you're now saying you're there from a clinical perspective,
Mhm.
and that's a big gap that's missing. Of when you're there at the appointment, you know what to ask, you know what kind of gaps to
Mhm.
fill, you know how to then relay that to the families and
Mhm.
kind of, right? Am I saying that all right? Like the
Yeah.
big picture, and to fill that void.
Exactly. That's exactly right. And that's just one example of so many of the on the professional side of services. Like you said, it's not just a task at home. Yes, we'll identify those to help support in the task at home, but it's those services that really require interpretation, interventions, implementation of certain things so that they maintain well-being very nicely in
Mhm.
wherever setting they're in. So, we want to make sure that they are stable and they're doing things as they should to help maintain their overall health. So it's very holistic for sure. Yeah, that's essentially what it,
Yeah.
it is.
And I wrote some things down. I think I quoted you correctly, but the last time we spoke, you said things like you sometimes hear families that are overwhelmed when you're dealing with this, right? And you're talking to them
Mhm.
and they don't know what questions to ask. And they've said things like, well, who's the clinician and who's interpreting these diagnoses and who's overseeing all this? They assume that's the big thing here is I think families assume this is part of that care plan, right? They just think,
Mhm.
okay, well, who's going to do all of this? Well,
Mhm.
they're having to do it.
Mhm. That's right.
And, they're asking these questions and you're like, well, now this is, Lorie Dancy and her company, she does this, but it's not what's typically offered.
Mhm.
And so they're then the ones that have to be doing this. And those are kind
Right.
of just some things you said that you're hearing. And second to that, you mentioned that, like I just said, families don't even know what to ask. They wouldn't even know to think of those things. If you don't have a clinical background or senior living
Mhm.
background or any of that besides, Google and ChatGPT,
Mhm.
how would you know a lot of this and what to ask?
Right.
So that's scary. I feel like that's a really it's a really scary place to be.
Mhm.
It's so when you were telling me this and you were telling me how you created this company, I then when I was doing my research realized the gap that's missing and how
Mhm.
I would feel if I was in this situation. And the next thing I want to talk about is engagement. I think that's really important
Mhm.
because obviously being in senior living, I know how important that is, but most people don't realize. They know it like hypothetically.
Mhm.
Like I think, older adults know I need to be social and I need to do things. Like they know that kind of,
Right.
but they don't understand from a clinical perspective. Like you said, how last we spoke, you mentioned how important it is that engagement should be as equal to the
Mhm.
medical care.
Mhm.
And I just think that alone, if anyone gets anything from this episode, is making sure that that's a part of the plan.
Yes.
Um,
Yes.
and just that impact that has overall, like you were saying, as part of the medical plan, part of their quality of life.
Mhm.
I just don't think families realize that. And so explain, maybe you can walk through a little bit of how what that process looks like. If
Mhm.
someone were to come to Concierge Care Network, what maybe walk them through then how what you offer is different and what that
Mhm.
process might look like.
Absolutely, yeah. So it's really based off of an assessment. So typically, with nursing, any nurse, any clinician, physician, you assess, right? And then we determine what the or identify the issue, problem, or diagnoses,
Mhm.
and how then we're going to treat and the interventions needed. So I really treat it the same. It's an assessment that is done. I do some of it. I have the family do some of it, and then I see about the person and have them do some of it as well.
Mm.
And it's all based on their level of ability. Some can do the whole thing and don't want anybody speaking for them, and others, it's more challenging. So there's an assessment. It's a pretty comprehensive assessment as well, very detailed, even down to what time do you wake up, things like that. So just so, in formulating a day for a person in terms of what they're going to engage in, I want to know the details. It's very important. So we do the assessment, and just like there's a nursing care plan or wellness plan, there's a plan created for the engagement. But it's all based off of their personal interests, hobbies, experiences, things like that. It's what they're interested in doing. It's all about encompassing their whole person as well. So it's not all physical, it's not all emotional, it's not all spiritual and social. And there's different dimensions that make us all up as a person. So we look at all of those dimensions. I look at about 8 or 9 of them and bring all of that together, and then look at their interests and what they're good at, or what they wish they still were able to do, or what they really like to do, or they want to do more of, and develop a plan for them. I have someone on my team as well who helps to develop even some more specific types of engagement opportunities for individuals when it's really a bit more challenging. They have some different types and unique types of needs, and
Mhm.
they will even take it a step further. So it's really personal in terms of it's not the same. No two plans are the same, nor should they be, because no two people are the same, right? So it's all unique. It's based on what they're telling me through that assessment process. So that's
Mm.
kind of how we get there. And
Mhm.
I treat it as if I really believe it is medicine.
Mhm.
You know, it's just so important. And just as much as taking that blood pressure pill can
Yeah.
be, if you think about yourself, and how many times do we, say, I need a vacation, when we've been working, 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 or doing, and doing, or, we're
Mhm.
stressed, or, whatever it might be, or we just need a break, or I need to go for a walk, or I got to get out of this house. Or here in the Northeast, we just had how much snow. And I said to myself the other day, I'm like, I don't think I've seen grass in 2 weeks,
Oh my gosh. Like a
because of
month.
snow and ice. Right? I'm like, what's the grass?
Yeah.
Where's the grass? And so automatically, like you start to feel what you're missing, and because that's a part of your overall,
Mm.
my overall well-being for sure,
Yeah.
is incorporating all of these things that we sometimes naturally are just used to,
Mm.
but when they're taken away is when you really find that we need them. So for a lot of older adults, they've been taken away because they may not be able to initiate them independently anymore. Maybe they don't drive anymore. Maybe if they're living alone, and they don't drive, it's a little bit more difficult. Or maybe they just, had a knee injury, or their children, who are nearby, or maybe they live with work during the day,
Mhm.
and it's so many factors. So, it's being very deliberate. Just like that prescription is written for that medication, this is a prescription of how we're going to engage daily. So it's pretty cool.
And how does this differ, just this just came up in my mind, but in terms of home care? So, like, we talked about
Mhm.
that's probably something that's a service that could be offered, right? That you could help them with. But this is
Mhm.
different. I'm hearing listeners probably thinking, okay, well that, okay, home care can add, can do those types of things. But explain maybe a little bit of how it's different. So home care is more like services, specific services that need to be
Mhm.
provided, not a comprehensive full,
Mhm. Correct.
care plan.
Yeah, that's the difference. So home care, yes, they are coming into the home. Home care for the unlicensed assistive personnel.
Mhm.
That's your HHA, your home health aide.
Mhm.
They're coming in because somebody needs help with bathing,
Mhm.
toileting, getting dressed, getting a meal, prepped, or assistance with eating that meal. They're doing those types of tasks,
Mhm.
even maybe just cleaning up their general area,
Mhm.
putting some papers away, keeping it neat, emptying the trash. If someone's getting home care from a professional healthcare provider, say it's, a nurse or a physical therapist or maybe an occupational therapist, they are doing a skill that
Mhm.
they've brought into the home because that person has a skilled need that qualifies them to be in the home. There has to have been an identified skill need identified by either a physical therapist, well, first the physician has to order it or the practitioner.
Mhm.
And then that has to be followed by either a physical therapist or a registered nurse to determine what that plan needs to look like. So the difference here is it's not just for those reasons at all. Do some of the people that I support through the company, you know, have those services? Absolutely, and they should,
Mhm.
because it's all a part of, what's important and their Medicare benefit and,
Right.
so many things to keep them going and to keep them strong, and it's holistic.
Mhm.
But there's so much more
Mhm.
that is there that they cannot tap into, frankly, because Medicare won't pay for it.
Right. Yeah.
That's the whole thing. Medicare is not going to pay for someone to come in and set up,
Yeah.
engagement and make sure it's happening. They're just not doing that.
Yeah. Yeah.
They're not going to pay for someone even, to do a lot of the clinical and care types of
Mhm.
things, and the education and the training and the retraining and the oversight and the getting ready for the doctors. They're not. They just won't do that. So there's a task that's needed. This person is trained and licensed to fulfill it. It's for a designated amount of time,
Mhm.
and they have to track that you're improving. Unless if you're not improving, then you really wouldn't get the service much longer
Hmm.
because you have to, show that you're improving.
Right.
So that's kind of the difference with home
Yeah.
care.
It's the service. It's not the whole package. It's not the full clinical support. It's not the oversight. It's not the engagement. It's not the full package. Thank you for clarifying that. And I do wanna
Of
speak a little
course.
bit when we last and you mentioned this earlier, and when we last spoke, it was really about your you're caring for, the patient itself, the person that needs the support, but this is also for the family.
Mhm.
And and again, that's why I keep coming back to that because I that speaks
Mhm.
to me. You talked a little bit about the sandwich generation, right?
Mhm.
And how you have these older adults who have children and young children that they're taking care of, and then they have their older adults that they're trying to drive them to doctor's appointments and then keep in their head what they need to do. And mom, did you take your pill? And right, they're having to kind of be in the middle of do
Mhm.
that. Talk a little bit about that and how you also support caregivers.
Oh, yes. I mean,
It's probably
it
half
is
of it.
critical. It's critical. It's critical,
Mhm.
because and you have, you know, the sandwich generationers, I've been one, and they want to make sure their loved one, their parent, that person is getting what they're supposed to have. They want to make sure of that. So it's an automatic built-in sacrifice of some kind, just because you want to make sure they are getting what they're supposed to have and what they need and what they deserve. I feel, what they deserve. So
Right.
um, it's very challenging for that person. And then they have their children on their other end often, or sometimes many don't have children, but they have their careers that have become like their children,
Yeah.
right? They're traveling the world, the country, the world, whatever it is. And it's very important to them. The children, their careers, it's very important as they should be. And they shouldn't feel badly about that.
Right.
They should not. And, how do you then meet both of those needs? So, what I have found is looking for what those gaps are with the family and their loved one that bring the most kind of tension, strife, angst. Oh, what again? All of those
Yep.
things. And how do we at Concierge Care Network meet that need?
Mhm.
Right? I have found a lot of it to be communication.
Mm.
So, of course, identifying those things that are the most painstaking, but then keeping them informed. They want to often still just be aware, even
Yep.
if they're not the ones anymore doing it. And that sometimes there's a lot of letting go of trust, of control to trust someone
Yep.
else to do this,
Yep.
even though Their hair's falling out. They're exhausted. They're
Well, and
not
they're
sleeping.
not skilled enough. I mean, frankly,
Right.
they feel this guilt, I can imagine.
Mhm.
I'm not in
Mhm.
this place yet, but they feel the bit of this guilt to need to take care of their,
Mhm.
which you should feel that respect
Mhm.
for your parent.
Mhm.
And not only do you not have the time and you're overwhelmed for these other reasons, but you also don't have the knowledge and the clinical
Yeah.
expertise or understanding of, like you were
Right.
saying, about how isolation and how
Right.
non-engagement can affect them. Like they just don't have, maybe they do, they could be doctors and nurses, but most of them, majority aren't. So
Yeah.
putting that on yourself, that
Mhm.
pressure, and not having that
Mhm.
insight is actually
Mhm.
doing your loved one a disservice,
It
unfortunately.
really is, but
Yeah.
they don't know that until they
Right.
can see that, "Oh, this is,"
Yeah.
they often don't know because they're just doing what they know and doing the best that they can. So it's educating them as well and showing them a different way as much as, it can make sense just by verbalizing that until they see it in action. I
Yeah.
recently had a client where, it was tough because they were actually in a facility and there were very many challenges. It happened to be a nursing home,
Mm.
and there were many challenges, and they weren't getting anywhere. And not only were the loved ones non-clinicians of any kind, no healthcare of any kind, they also definitely were not understanding the culture of a facility.
Mhm.
And we know a nursing home is different from an assisted living, which is different from an independent living, which is different from memory care,
Right.
so and a hospital.
Right.
So now it's not all one bucket,
Yep.
so going in there and being able to speak the language of,
Mm.
the people there, all of a sudden things start to turn. The tide started to turn. And it's difficult and challenging, and someone who they're saying they don't want to be here anymore, now they're like, he's doing great.
Yeah.
So it's really so many facets, that are a part of it, and making sure that person is getting what they need and have, and having a presence
Mhm.
in a certain way as the person who knows, the expectation.
Right.
It all matters. It all matters. So it's relieving, those loved ones. It's giving them the relief to say, oh, I could go on vacation.
Yeah. I'm
you know,
doing what needs to be done. I'm taking care of my
yeah,
loved one, but I can't do it all
right.
myself. And
Exactly.
I I think what you just said about the senior living communities, I hadn't really thought about that, but obviously I'm doing the marketing for senior living and I'm thinking about, and I was on the sales side, so I know what that's like when the adult child is coming and they're trying to learn about all the different places to live for their senior
Mhm,
parent, how hard that is for them. I hadn't even really thought about that
mhm,
having someone like you who can help them through understanding the whole picture. What is it they
mhm,
need? They can no longer live at home by themselves.
mhm.
This isn't realistic or safe.
That's right.
You can help start them off on that journey of these are the types of senior livings and this is the right place where
Yes.
your loved one needs to be, and then being able to oversee, like you're saying, once they're there, because you've seen it, I've seen it, where, like
Yes.
you said, they come to a community and they don't do well, and many times it's,
Mhm.
well, senior living communities aren't great, or they're not
Right.
doing what they need to be done.
Right.
You need to have someone to oversee even
You
that.
really do. You
Yeah.
really do, because the senior living community is there and doing a great job with what they're there to do.
Right.
But an individual requires a lot.
Yep.
They require a lot. So I have found that a lot of people just maintain that and
Mhm.
continue that because they know that, there's a limit in a sense too, as there should be,
Right.
when it comes to the details and the personal needs of every individual being met. So they continue really with the care. I call them care advocates, that's our
Yeah.
company, and they continue with that and work side by side in meeting that person's needs with the location
Hmm.
wherever they are. Not in, and I've experienced this having been, on the senior living side for so many years, but it's not working against, it's working together
Right.
with
Yeah.
that community. and meeting the needs and hopefully lightening the load for that community in certain ways that are beneficial to the community, to that person as well. So, yeah.
So everyone listening is probably thinking, okay, great. I know someone or I know of someone or some senior living community that could use this. So what does this look like? I mean, I feel like from an industry perspective, this should be something that's referred, which I'm assuming it's not very often,
Mhm.
right? From
Yeah.
doctors, from
Yeah.
care, managers, or how are you getting, besides, you marketing yourself, what does that look like? What does our industry need to change, or what do they need to
Mhm.
do to get this type of a company into the homes of these families?
Yeah. Yeah. I think a couple of different ways. People that are at home privately, yes, people just don't know about the service, and it is a little unique
Yeah.
than typical, obviously, geriatric care management. So it's, really physicians and all the practitioners, adult day centers,
Mm.
to all the different areas where people touch and reach that get some sort of a service, they definitely need to refer and know that there's continued support. I've even seen with hospice when I, work with hospice that there's sometimes people come off of hospice and it gets a little nervous because what you tend to see then is once they're off of hospice because they don't qualify anymore,
Mm.
things start to turn. So having someone to be able to step in, and continue the, checking and the monitoring of that person so that they maintain, so all kinds of different types
Mm.
of settings can really help and be of assistance. Home cares, are a big one as well. So it's just, really informing and educating. And I think also for senior livings to get to know care management groups so that it's not a competition,
Yeah.
right? Because that person is where they need to be. They're there at that community for a reason and they need to be there. But then also, you know, saying, but there's more that they can have and there's more that, is needed. This situation's a little bit different and this is why. So that's one aspect of it. The other aspect is the support that I know I'm giving to assisted livings and the memory care communities, helping them to see that role of that nurse in that community is extremely vast.
Mm.
It
Mhm.
is vast, and it is often very, very, very challenging to be successful in that role because of it. And it's not just vast in a lot of little things, they're all pretty big things,
Yep.
that are required and needed and important. So, um, supporting an assisted living by supporting that role, that wellness
Mm.
director role, on a lot of tasks that often get overlooked but are critical to customer satisfaction, resident outcomes, that follow up, communication with families. That's where Concierge Care Network is also able to support and come in,
Mm.
keeping that person in place. It's not that one on one private care management and
Right.
maybe that senior living, but it's for the entire house.
Yeah.
Every patient, every resident gets some sort of concierge level service through the company that's
Yeah.
supported and partnered by the assisted living.
No, that's interesting. I think you're right. There's such a competition between, they need home care, they need to go to a community, they need to stay
Mhm.
home, they need,
Mhm.
well, and I'm this care manager, and then we
Mhm.
all want, just from, especially from the past couple of years, and I've been doing this podcast, everyone I'm talking to, we all want good outcomes for our residents, or,
Yes.
the residents, the patients, whoever it is that, the senior population that you're working with. That's
Mhm.
what we all want. That's why we're in this industry. That's why we do this. Even marketing. I know, people don't believe it's true. That's what
It's
we want.
true.
We truly want them to find the right place for them
Yeah.
to have a better future. And so if we all, what I want everyone, all the listeners to hear, if we all get behind supporting each other and having better outcomes, this is one of the keys, the gaps that's missing that can
Mhm.
take it that next step. So like you said, when they're in a senior living community and it's not going well, what
Mhm.
you can help, fill the gap there. Or
Yeah.
they're at home and something's happened in isolation, they're not getting engagement, what's
Mhm.
going on there. Or they have 5 or 6 different doctors,
Mm.
that no one's coordinating.
Yes, that
Gosh,
is.
why can't the doctor recommend it? It's like, that's the kind of stuff, that missing gap. And so I think what you're doing is just really important. And I hope that more people spread this and do this more across the country, because it really is so important for all of us, everyone in the industry that is all in the different areas.
Mhm.
It's so important. I do want to end today, make sure. So one of my final thoughts I had here was, if no one's overseeing the whole picture,
Mm,
then who is?
right.
And that's something you have to ask yourself as a
Yes.
professional,
Yes.
as a loved one, a family member. Like, just
Yes.
ask yourself that. And if it's really no one, what are you doing about it, and
Right.
what changes are you going to make? So I want you to leave us, if you can. I know we talked about a lot of different things. Any, top key takeaways you want to leave, today for the listeners?
So, top key takeaways. I would say number one, to not hesitate to find out what else is there. It's because this is kind of new.
Mm-hmm.
This is kind of new. Um, it's not common,
Mm-hmm.
but the support is there. It's there. So to investigate, ask the questions, look, see if it's a fit, find out how it could be beneficial to you. Try it and see. Um, that's often the need in the way that people start to say, like, oh my goodness, I just didn't know. So give themselves that chance, show themselves some grace.
Mm.
Do not feel badly when you're exhausted and you're tired and you're caring for someone and looking after someone who is older and you are tired that day and you wish you didn't have to.
Mm-hmm.
Don't feel badly about that. You're human and you need help. I have been in those shoes, and the support is there. And you're still caring and giving to your loved one, even if it's not your hands all of the time.
Yep.
Even if it's not your hands all the time, you are still looking after them well. So give yourself a little grace, is what I would say. That's the main takeaway I would have.
Yeah. Oh,
Yeah.
thank you.
Sure.
Thank you so much, Lorie Dancy, Concierge Care Network. I will have the link below. Please check it out. Please share this, with your loved ones, friends. Again, if not Lorie, someone else in your neck of the woods, in your state, in the country,
Yeah.
just start to make a change. I
Mhm.
think, Lorie, when we met and you, went through all this with me, I'm like, this is this needs to change in our country and in our world. And thank you for kicking it off in our neck of the woods. Always so great talking to you. I know we've been friends for a
Same
long
as
time. Thank you
yes.
so much for joining me today. Thank you for being on. And thanks everyone for watching another episode of the Drake Insights podcast. I look forward to seeing you all next time. Bye. Real quick, if you enjoyed watching the podcast today, please follow me and subscribe so you're notified for the next podcast. And if you have any questions or want to talk after about anything that Drake Strategic can provide for you, please reach out to me, call me, email me, or visit our website at drakestrategic.com.